Hi, I'm Calvin Bagley from PlanFit, and my combined companies have helped over 50,000 people to make a choice about their health and Medicare insurance. And today, I'm going to talk about 7 surprising things that Medicare does not cover. If you have Medicare, you have a red, white, and blue Medicare card. Your Medicare card has your name and your Medicare number, and also your Part A and B effective dates. Part A and B of Medicare are what we call original Medicare, because that's what Medicare was when it started. But there are 7 things I'm going to tell you about today that original Medicare does not cover. You don't want to be in a situation where you get a surprise bill because you had a service performed or a procedure that is not covered by Medicare. Okay, let's jump in. Here's the first surprising thing that Medicare does not cover, and that is dental care. Medicare has no coverage for anything that you would consider regular, standard dental care. So if you need a cleaning, an exam, x-rays, a filling, anything like a root canal or a cap, any of these things are not covered by original Medicare. So what can you do if you have original Medicare and no other coverage with it? Well, you could look at a standalone dental plan. There are dental plans that you can purchase that are just for dental insurance, and then you would have some coverage. Another way that a lot of people get coverage for dental is they join a Medicare Advantage plan, but you have to be sure that that's the right thing for your situation. For many it is, and they join a Medicare Advantage plan, and now they have some dental through their plan. How much dental do you have? Well, it depends on the plans available in your area and the plan that you select. One important thing to understand is there's Medicare Advantage insurance and Medicare Supplement insurance. The Medicare Supplement insurance does not cover dental. So in that case, you would need to look at adding a dental plan, like a standalone dental plan, in order to have some coverage for dental. So that's kind of a surprise because your teeth are really important for your health. The second surprising thing that Medicare does not cover is hearing aids. Even though hearing and being able to interact with the world around you is really important for your health and your well-being, Medicare does not cover hearing aids. Medicare does have benefits that will protect your ears. So if you have an accident or you need some sort of a medical procedure related to your ears, then there is coverage for that. But if you just have hearing loss, which often comes with age, then there is no coverage for hearing aids. So what can you do? Well, one of the ways that people get coverage for hearing aids is through Medicare Advantage. There are a lot of Medicare Advantage plans that have hearing benefits and that will help you at a reduced cost or sometimes a low or no cost get a hearing aid so that you can hear and interact with the world better. But with a Medicare supplement, there is no coverage for hearing aids. So again, it's like the dental conversation. You have to look at a plan that covers hearing aids. There are dental, vision, and hearing plans that will cover hearing exams and hearing aids, or at least help you with the cost of those things. If you don't go the route of insurance, then you can purchase a hearing aid. You could purchase a hearing aid on a payment plan, or you can finance it or pay cash for it. There are also big box retailers that now offer some sort of hearing aid. So you may be able to find a hearing aid at a reasonable cost if you're going to purchase it on your own. But unfortunately, Medicare is not going to help you with that. The third surprising thing that Medicare does not cover is routine eye care. Now, I'm not talking about things like glaucoma or having cataracts. Those are medical conditions that Medicare does cover. And in fact, after having cataract surgery, Medicare will help you to get glasses or contacts one time after cataract surgery, but that's all the coverage. Now, that's not coverage for routine eye care or for getting glasses or contacts or having a routine eye exam. It's just for those medical conditions. So what can you do? There are many Medicare Advantage plans that have coverage for routine eye care and will help you to get glasses and contacts and those sorts of things. If you have a regional Medicare with a supplement, Medicare supplements do not cover anything that Medicare doesn't cover. And so you're not going to have coverage there. So you could look at a standalone plan, or like in the other case, you could reduce your costs by finding senior discounts or going to providers that have lower costs when it comes to routine eye care. Before we go into the next surprising thing that Medicare does not cover, I just want to jump in here real fast and say, if you're finding this video helpful, please hit the like button. Our mission here at PlanFit is to make Medicare easy and understandable for everyone who has Medicare. By hitting the like button, you will tell YouTube that this is a helpful video, and you will help it reach a lot more people who might be struggling with Medicare right now. All right, let's get back to the video. The fourth surprising thing that Medicare does not cover, and this is a big shocker, is prescription drug medication. Medicare under Part B does cover a lot of medications that are delivered intravenously, like chemotherapy and some other treatments. But prescription drugs at the pharmacy, almost all of those are not covered by Original Medicare. The only way to have coverage for prescriptions at a pharmacy is to have a prescription drug plan. And you can get a prescription drug plan one of two ways. You could have it through your Medicare Advantage plan, and if you have a Medicare Advantage plan that includes prescription drugs, then you have to use that prescription drug plan. You can't get a separate prescription drug plan. If you have a Medicare supplement, then you get a prescription drug plan that's a standalone prescription drug plan. And you are required to do this, and it is Medicare Part D, but it's not Original Medicare, it's not from the government. Prescription drug plans only come from insurance companies. The fifth thing that Medicare does not cover is long-term care. Medicare will cover you if you need to stay in a skilled nursing facility to, let's say, recover from a surgery or something. That is covered by Medicare up to 100 days. But at 100 days, the benefit ends and you no longer are covered to stay in that skilled nursing facility. Now, if you're in a situation where you can no longer take care of your activities of daily living, like bathing and dressing and eating, and you need someone to help you with those things, Medicare does not cover that. So you have to either plan ahead and purchase long-term care insurance. You can't purchase long-term care insurance when you need it. You have to do that in advance, and that could help you cover the costs of long-term care. Or you use your assets, and if you get to the point where all of your assets are depleted, then you go on to Medicaid, and the state will help to pay for the costs of your care. So Medicare does not cover that type of long-term care, just the short-term skilled nursing facility for recovery from surgery or from some medical condition. The other thing about skilled nursing facility coverage with Medicare is that it has to be preceded by a 3-day stay in the hospital. So truly it is just for medical care and not for long-term care. The sixth thing that Medicare does not cover, which is a real surprise, is your annual routine physical. Now, when you first join Medicare, there is a full physical that you can qualify for. And I'm talking about traditional Medicare, remember Parts A and B, not Medicare Advantage plans and that sort of thing. But on Original Medicare, there is an annual wellness visit that you can have every year, but that is different from a traditional physical exam, and it lacks some of the things that you would expect in a physical exam. If you have Original Medicare, then make sure when you go to your doctor for your annual visit that you tell them that you are there for your annual wellness visit so that they bill that correctly to Medicare, or you could get a bill in the mail for an annual physical exam that is not covered by Medicare. For those who have a Medicare Advantage plan, Medicare Advantage plans almost always include an annual physical and other annual visits because Medicare Advantage plans are usually focused on preventative medicine and prevention. If you have Medicare with a supplement, then use that tip that I mentioned when you go into the doctor for your annual visit. Make sure you have them bill it to Medicare as the annual wellness visit and do the things that go along with an annual wellness visit, which is different from an annual physical. Okay, this brings us to number 7, the final thing I'm going to share with you that is surprising that Medicare does not cover, and that is an emergency outside the United States or any treatment outside the United States. Medicare has no coverage when you're traveling outside the US. So if you're traveling and you're outside of the country and you need to visit a doctor or go to an emergency room because you've been in an accident or you've been sick, you're going to be 100% responsible for that yourself, as long as you're on Original Medicare, A and B. But if you have a Medicare supplement, many Medicare supplements have coverage of $50,000 when traveling outside the US, and many Medicare Advantage plans on the other side have coverage when you travel outside the United States as well for emergencies and that sort of treatment. Most of this coverage for outside the United States that comes from supplements and from Advantage plans is not for seeking treatment outside of the United States. It's just for emergencies. But there is usually coverage there if you have a plan that goes with Medicare. If you just have Original Medicare A and B and you're traveling, then you should consider purchasing a travel insurance plan that can cover you for that trip. Usually those are not terribly expensive and would cover things like sickness or a visit to the ER, and in many cases include some form of life insurance with them. So those are the 7 surprising things that Medicare does not cover. If you would like to learn more about Medicare and how to save money with your Medicare and avoid penalties and fees, then watch my workshop. The link is below. And don't forget to like and subscribe for more simple Medicare lessons.